Reassess when you're reassessing a patient, make sure you reassess their mental status, airway, everything you'd reassess with everyone. However, sometimes these older people can deteriorate quicker than the younger people can, so make sure you keep an eye on that. Okay, so why do we get out there? Why do we get called out there for other than that? Okay, they have what's called polypharmacy. They have a lot of medications that they are taking, and things are improving with the advent of computers and so forth. But, back in days of yore, you had a cardiologist, you had a pulmonologist, you had a primary care physician, and none of these doctors were talking to the other doctors, and nobody knew what was being prescribed, and especially if the patient didn't have a good list of the medication to tell each doctor. Now, pretty much anytime you get a prescription, most all of your doctors are knowing what prescriptions that you're taking. So they may have some prescriptions that kind of work against another prescription that they have. They don't really jive well together. Medications can be very expensive, especially the ones that are on fixed incomes. They may not be able to afford their medication, so they just quit taking them, or they cut them in half to make them last longer. There may be some drug and patient interactions, such as if you smoke. Some drugs don't do well if you smoke, but if you quit smoking, then they'll work great. So it just depends upon the patient itself and the medications that they're taking and the other medications that they're taking on how they're going to do with their prescriptions. Now, I think I spoke about this during cardiology, that some of the worst difficulty breathing calls that ever went on were actually cardiac in nature. So it goes along here with the elderly that they may be actually having an MI if the difficulty breathing is the only complaint that they have. Again, they can have an MI and go into congestive heart failure, and the pulmonary edema causes them to have difficulty breathing. The generation that is elderly now, there's a lot of cigarette smokers or past cigarette smokers, and there's a lot of COPD among that bunch. Congestive heart failure, and then pneumonia. That's the fourth leading cause of death in the elderly. Chest pain, as we talked earlier, the older you get, the less pain sensation that you have, especially if you're the woman that is elderly and she's diabetic. They're the ones that are notorious for having silent MIs. They may just be having, I'm having difficulty breathing, or I just don't feel right, or I'm weak and dizzy, something of that nature. So with chest pain, they could have shortness of breath, may not have shortness of breath. Remember, it could be angina that's typically relieved with nitroglycerin. It could be an MI, or it could be an aortic aneurysm. Okay, so I'm sorry I got ahead of myself earlier. So now we're to the difference between delirium and dementia. Again, delirium is usually caused by something. It can be caused by medications, a stroke, hypoglycemia, an event in their life, and delirium is reversible. All right, and it's more of a focal issue in the brain than something more global like dementia is. Once you get dementia, you got it. You ain't going to get rid of it, and you can slow its progression with certain medications, but you're not going to get rid of dementia. Stroke, leading cause of death in the elderly. It is preventable. Some of the preventable risk factors are going to be the smoking, the obesity, and the sedentary lifestyle. These are still preventable, but a little less preventable would be your high cholesterol and your hypertension. Of course, there's medications and diet that you can take to help with that. The uncontrollable factors would be cardiac disease, and people who have a ECG rhythm is called atrial fibrillation. Basically, what the atria is doing, instead of contracting 60 to 100 times a minute, it's quivering somewhere between 250 and 350 times a minute. So the blood tends to become stagnant and just kind of swirl around a little bit in that atria. And if that happens, then the blood's going to tend to want to clot. piece of blood clot may make it down into the heart, be pumped up to the brain, and you have a stroke. Some other complaints would be abdominal aortic aneurysms and bowel obstructions. Bowel obstructions can be so severe that the patient may actually be vomiting fecal matter. There's the good old weak and dizzy, and then the depression and the suicidal behavior. Don't think that the loss of a spouse can actually cause people to die. Not necessarily that they're committing suicide, but the depression itself is called broken heart syndrome. If you guys know who Doug Flutie is, I believe it was his mother and father that were in a nursing home together or whatever, and dad died and mom was there, and mom leaned over to kiss him and mom died right there on top of him. So I can tell you from family that I had a family member that did not live too terribly long after the loss of his wife. So there is such a thing as a broken heart syndrome, and again, it's the depression really that's killing them. It's not that they're committing suicide because of that. However, some spouses do commit suicide when they do lose a spouse. Shingles is the varicella virus, which is the same thing as the chickenpox. And so if you get the shingles, regardless of what age, any age can get the shingles. But if you get the shingles, it feels like somebody has just poured hot ashes on whatever part of the body that you have the shingles. Usually it's going to be on the thorax or somewhere around the head. If you get it on your forehead or somewhere around your eyes, it can actually migrate to your eyes and it can blind you. As you get older, when you turn somewhere between 50 and 60, you can go get a shingles vaccination. The one that they have out now is about 90% effective. The one they had before this was about 50%. So hopefully by the time that you guys get that old, then it will be 100% effective whenever you get your shingles shot. 25% of all falls result in death. It doesn't mean that they died because of the fall directly. It could be indirect causes that they died from later on, like we talked earlier with the broken hips and throwing blood clots due to the sedentary lifestyle that they lead afterwards. The impact on their lifestyle can be devastating. You guys are probably all in your 20s and 30s. You can probably do anything physically that you want to do right now, and as you get older, you just don't do things anymore because you get a little bit smarter. I know how to climb a ladder. I know how to walk on a roof, but I'm smart enough that I'm not ever going to do it again. I'll call somebody to get up on my roof and do whatever I need to have done on the roof. They're going to be a lot cheaper than me falling off that roof and breaking a hip. There also can be some circumstances that are often linked to some serious disorder that they may already have. I was a caretaker for my mother when she got Alzheimer's. I can tell you it's pretty brutal, not only physically but emotionally, to take care of someone who is elderly and has a mental issue like Alzheimer's. I was always told by all the experts, you got to take care of yourself before you can take care of each other or someone else, and that's kind of hard to do because I was very close to my mom, and I always felt like she came before me, and sometimes I'd overextend myself, and I'd be the one that needed to be taken care of. So please make sure if you are a caregiver, none of this needs to be in your wheelhouse. These are your family members, but these can certainly happen if you've got a caretaker who is not a family member trying to take care of the elderly. Sometimes the old people they'll either give you the silent treatment or you give them the silent treatment. And then there are unbelievably there are family members that will take mom and dad's money and spend it on themselves instead of spending on the care for their mom and dad. So it's unfortunate there's a lot of exploitation of resources. Old people do not like to go to the hospital. They felt that they have lost control of their own circumstances. They know, especially now, the hospital is not letting any visitors come in, so they're going to be separated from their loved ones. The high cost of hospitalization can completely wipe out their life savings. They also think that they're never going to go back home. They think that they're going to stay in the hospital and die there, or once they get released from the hospital, they'll go to a nursing home. So if you have an older person that asks you, please take me to the hospital, you need to do that, because there's definitely something going on with them if they ask you to take them to the hospital. There's not a whole lot of slides here. I think there's 3. So more and more infants and children with special needs are being taken care of at home. The way the technology has progressed, they can now be taken care of at home by either family members or by home health providers. Used to, a lot of them were institutionalized. Don't be surprised to see these kids in public schools. They're allowed to go to public schools like any other kid can. And so we could spend 8 hours talking about infants and children with special needs, but there's not a whole lot you can do for them on the EMT level. There's really not a whole lot I can do as a paramedic either, but some of the kids that you may go out on, the last thing to develop in a fetus is going to be the respiratory system. So there may be some kids that were either, premature, that they spent 3 weeks, 4 weeks, 4 months in the hospital, and now they're at home. Well, their lungs are probably still not developed, so you may make calls on them. Some kids are born with congenital heart defects. Again, there's nothing you can do other than transport to the hospital if you recognize really either one of these. Now, with the lung disease, certainly you can, support their airway, support their breathing and their oxygenation, but not a lot you can do for the heart disease. Neurological disease, they may have been born with cerebral palsy or something of that nature. And then there could be chronic disease, or there could be some type of function that's not right since they were born. And again, that's most likely something congenital. The best advice I can give you when you're dealing with kids with special needs is probably mom and or dad. Usually it's the mom. They quit work, whatever they were doing for a living, they quit, and they're the primary caregiver at home. They know more about their kid than the pediatrician that's seeing that child. And so do not be ashamed or afraid to ask these caregivers to do your job for you. I can tell you that they're going to be more comfortable with it, and you certainly are going to be more comfortable with it because they deal with it every day. This could be a once in a 4 or 5 year span that you see a patient, a child with special needs. You don't go out on a lot of these kids, so you're pretty anxious because you just don't see them. I think the more that you see these kids, the more comfortable you're going to get with them and know what to expect. Because these are the most vulnerable population that we have, you're always going to be on your A game, but you want to be on your A game, but you're probably going to fail that, I'm going to fail here. I'm just not real sure what I'm supposed to do. Again, don't be afraid to talk to the family members and get the family members or the primary caregiver to help you do your job or to do your job. I have done that before, and I promise you that the mother of this premature child was a lot more comfortable with her doing it, and I can assure you I was more comfortable as well. So if you do have a child with special needs yourself at home, then you probably are going to be a little bit more schooled in how to take care of these kids, a lot more comfortable taking care of them. Okay, so this ends up these 3 lectures. Good rest of your day, and we'll talk soon. Thank you.